Officials from health centers used to ask for drugs from National Medical Stores, NMS, in line with the Ministry of Health policy. But this changed. Now health centers 3s and 2s wait for the drugs to be delivered to them.
NMS sort of like found it difficult to deal with that situation because they reported that they're not getting orders.
Martin Oteba from the Pharmacy Department in the Ministry of Health says this change was made after health centers complained of constant drug shortages, yet their orders were inconsistent. Previously, health centers got drugs from NMS after making requests, a system referred to in health ministry circles as pulling drugs. But it has now changed to getting the drugs without making requests, known as pushing the drugs.
The NMS circle is 2 months.
With this comes way too many drugs, more than the health workers at Alero Health Center 3 in Nwoya district need.
We don't need them at all.
While they appreciate the fact that they're getting most of the medicines that they need, they're disturbed by the fact that they're brought in rather larger quantities. And what is the result? This. Boxes of medicines that are getting expired. All this is wastage. Medicines that could be used in other health centers. What is the expiry date? May 2013 is the expiry date for this, and they're still here.
Around 3 bottles that are expired, and each has 1,000 tablets. So, like in a month, we have few, mostly we give to asthmatic.
We collect all those expired drugs and bring them to one central point in the district health office store, where we expect National Medical Store to come and pick it and take to a central point in Nakasongola for destruction.
There's that procedure of, in case the other health center is lacking, you send it there. Like ours, we have excess. We check for the one that are soon going to expire. We give others so that they use it before the expiry date comes.
One time we wrote to National Medical Store, stopping them from supplying us coartem. But they went ahead to continue pushing to the lower facility. Not until we raised the issue again is when they really stopped the supply. But the coartem that they were forwarding was having a shorter shelf-life.
We need to verify that. But the standing position is that the NMS should be, once notified by the facility or by the DHO, is supposed to retrieve those things back to the center for safe custody and also disposal.
The district drug inspection officer says that as a district, they have strategies for redistribution, especially drugs with a short lifespan.
First priority goes to facilities within the district, then other nearby facilities like Gulu Hospital and 4th Division Military Hospital to avoid just this kind of losses.
In spite of all the shortcomings of the drug push service, the main explanation from the Ministry of Health is that the staff shortage plays a big role, particularly in districts like Nwoya.
You've just told me about a midwife getting away from a delivery room to help in the clinical right. You can see that is a challenge. Uptake of supplies is much dependent, not necessarily only on the rights, but actually on the presence of the human resources that can have the right level of prescribing these medications.
District health officers are, however, tasked to take care of monitoring the usage of the medicines.
Within the jurisdictions of the district, transfer these supplies from where there is a low uptake to where there is a relatively higher uptake. Some districts are doing it perfectly well, others are not doing very well.
He, however, says that oftentimes the politicians and technocrats clash.
Look at movement of products from one facility to the other as actually grabbing from that facility.
He adds that the district has surprisingly been asking for more drugs.
Now you are revealing, it's a revelation, that the same places again have excesses, which is a bit of a problem to us.
Actually, the medicine that gets down, especially to the lower health center 2 and 3, are not actually adequate. And sometimes the quantification which are made do not conform with the kind of diseases that we may have in the community.
Some other drugs are pushed and may not help, they are not of use.
Sometimes, however, it is other supplies other than drugs that are in excess.
Patients, when they see a vehicle has come with it and they know they've brought medicines, they don't want you to tell them this one is not there.
But for the excess unwanted drugs in Alero, many people rush to the health center to take all they can. They still can take home.
They come and pretend. For you will be seeing them knowing they have cough, what. Because we realized late, there were 3 cases of that drug abuse by children to asthma.
It's also expired.
Yeah.
The fact that many drugs are going to waste in this health center and in others can't be ignored.
I foresee not far in the future, or maybe, who knows, in 2-3 years' time, a scenario where now we go back to more facilities, being able to make their orders independently.
At the moment, only hospitals and health center 4s, with the exception of a few health center 3s, are involved in pulling their own drugs from national medical stores.
November 2012.
Yeah.
And they're still here.
Yes, and we know them, we don't use them.
The greatest fear in all this is that patients may unknowingly end up getting expired drugs because some are given by non-qualified staff. This poses a great threat to an already needy health sector. Florence Naluyimba, NTV.